Screening and preventative tests free with Momentum Health.
As we get older, our bodies and what we need to stay in top health starts to change. The good news is that getting older doesn't mean you have to age. Doc, thanks so much for chatting to me. I've all of a sudden become more aware of aging and my health. What makes me age?
There's basically two theories that has to do with aging. The one is that it's predetermined by our genes, and the other one is that it's cells that get damaged and cells that die, and that's why we age. And cells have a certain amount of times they can regenerate, and then at some stage they stop. But people are living longer, and you know better how to protect and what to do. So you don't just want to get old. I think you need a good quality of life, and for that you need to maintain your functions and have a good life rather than just a long life. And I think that's what we're all striving for, and trying to do screening tests and be active.
Up to age 18, our bodies make more new cells than cells that die. From 18 to 25, the number of new cells matches the ones that die. But from 25 years on, more cells die than we replace.
So as you get older, from 25 to 30, I think you should start definitely considering screening. And I think we can start with the basics: blood pressure, glucose, cholesterol. Then there's specific tests that one would advise for men and women. Firstly, on the men, probably have a prostate exam and the rectal exam, where the PSA is a good screening for men with prostate. And then on the women's side, obviously everybody knows about mammograms. You can, from 40 onwards, do it every 2 years, and then once you get 50, you can do it annually. And then obviously pap smears for women. If you find human papillomavirus on the pap smear, you'll do it annually, otherwise 2 to 3 years is fine. The other one that's quite important as well is sigmoidoscopies and colonoscopies, to especially screen your bowels for cancer. If you start doing that, you're pretty well covered.
Besides the screenings, what type of vaccinations should we be aware of?
Nowadays for women, there's a vaccination against the HPV virus, the human papillomavirus, which is probably one of the biggest causes of cervix cancer, and that's really good preventative for that.
Doc, I've just recently gone to the pharmacy and they've done a prick test to check my cholesterol, and it's come back and they said it's high. Is that something I should be concerned about?
So it's a good screening, but I would recommend do a fasting lipogram, and it's a blood test. They need to take a vial of blood, not just a finger prick. Usually gets sent off to the lab, and then they'll do the complete lipogram.
Testing your blood is often the only way to find out what's going on inside your body. It's a simple procedure that takes less than 10 minutes to get a clearer picture of your state of health.
A blood test can measure your cholesterol, a waxy fat-like substance in your body. Too many low-density lipoproteins, or bad cholesterol, increases your risk of heart attacks. Testing your blood sugar levels helps detect diabetes, and issues with your blood electrolyte counts can indicate kidney problems.
And Doc, what about those aches and pains that we start to feel when we're getting a little bit older?
As we said earlier, we get cell degeneration and our cell dies. And if we have a look here as an example of the knee, we can see very little cartilage, literally bone on bone, causing you arthritis and those aches and pains. Women have less bone density than men, and that's why they're prone to osteoporosis more than men.
Is that why I've got to take calcium supplements?
Yes. But so I would recommend you start with a bone density scan, and you'll either have normal bone density for your age, it's age related. If you've got osteoporosis, you probably need calcium supplementation plus a form of medication so that you can build strong bone again.
You've spoken a lot about prevention. What can I do at my age to ensure healthy living as I get older?
Yeah, I think that's probably a question everybody wants answered. As we know, stress accelerates aging, it attacks your cells, it damages your cells, leads to unhealthy lifestyle habits. I think it's important to stimulate your mind. We all know Alzheimer's is on the increase as we get older. Sleep is important. Less than 6 hours they've shown to have an increased risk of myocardial infarctions and strokes if you sleep less than 6 hours. Nutrition, very important. Go slow on the unrefined sugars. Try and get your fruits and nuts in. We know that exercise acts as an anti-aging mechanism. You release a whole lot of hormones when you exercise, which is really good for you. I think it's important that patients take ownership of their health and understand their health and their bodies. It's one body that you've got and you've got to look after it.
Screening and preventative tests free with Momentum Health.